Hello everyone. The case study for this lesson is about the relationship between sport and mental health. I would like to share some important information about the European Alliance for Sport and Mental Health. This alliance is a project aimed at creating a European network that promotes the benefits of sport for psychiatric prevention, treatment, and rehabilitation. Mental disorders affect more than 160 million Europeans each year, and several studies have shown that physical activity and sport can be effective in preventing and treating mental health problems, improving the quality of life of those affected. Sport not only improves physical health, but also raises mood and self-esteem, encourages socialization and sense of belonging, which is crucial for those who have mental disorders and tend to live in isolation. The Alliance project is coordinated by ECOS and works with various international partners to create training materials and tools for sports instructors and health professionals. The goal is to promote sport as a tool for promoting mental health and help those who suffer from mental disorders to have a better quality of life. In this slide, we will understand the background of this study. I would like to bring your attention to a growing concern that affects millions of people in Europe, mental illness. Mental health refers to our ability to function in our daily lives and cope with stressors due to our mental state. Unfortunately, in today's fast-paced and demanding society, mental illness are becoming increasingly common and are affecting individuals from all walks of life. The World Health Organization estimates that 1 in 4 people worldwide will experience a mental or neurological disorder at some point in their lives. In Europe alone, over 160 million individuals are affected by mental disorders each year, which account for 38% of the population. This is a staggering number that cannot be ignored. Sadly, despite the growing prevalence of mental illness, only a fraction of those who require treatment receive adequate support. This is due to several factors, including a lack of appropriate policies, resources, and skills, as well as social stigma that makes individuals hesitant to seek help. As a society, we must take action to address these issues. We need to work together to create a more supportive environment where individuals can seek help without fear of judgment or discrimination. This includes implementing policies that provide better access to mental health resources, training healthcare professionals to recognize and treat mental illness effectively, and increasing public awareness about the importance of mental health. We also need to recognize that mental health is not just an individual problem, but a societal one. We must work to reduce the stigma associated with mental illness and create a culture that supports and empowers individuals to take care of their mental health. In conclusion, mental illness is a growing concern that affects millions of people in Europe. We must work together to address this issue and create a more supportive environment where individuals can seek help and receive adequate support. So we can talk about the benefits of this project. In recent years, research has shown the significance of tailored treatment programs that combine medication, psychosocial activities, and work reintegration paths for individuals. Furthermore, evidence suggests that physical activity and sports are effective in preventing and treating mental health problems while improving the quality of life of those affected. Many studies have linked physical activity to positive changes in mental well-being, including increased core body temperature, endorphin production, and changes in neurotransmitters and central serotonergic systems. In addition, physical activity enhances physical health, boosts mood and self-esteem, and encourages socialization and a sense of belonging. This is particularly crucial for people with mental illness who may live sedentary lifestyles and face social bias and shame. Additionally, physical activity can counteract obesity, metabolic, and cardiovascular disorders, which are major causes of excess mortality in people with severe psychotic disorders caused by antipsychotic drug use. Sport and physical activity, when combined with medication and psychosocial rehabilitation, can form part of an integrated model that promotes a new approach to mental health intervention that is centered around structured physical activity.